every day and in every way. Enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Digital health is changing the way we access care. From telemedicine and mobile apps to wearable and AI-powered diagnostics. For many Nigerians, it means faster treatment, shorter waiting times, and access to doctors without leaving home. The benefits are huge: better reach to rural communities, real-time monitoring of chronic diseases, early detection of health risk, reduced healthcare costs, and stronger public health surveillance. Data privacy is a growing concern as sensitive medical information moves online. Misinformation spreads quickly on unregulated platforms, and technology is not perfect. AI can misdiagnose and systems can fail. And this is why the How Body app, a digital platform, was created so people can access mental health services from anywhere in the world. The revolution is here. The question now is, are we ready to use digital health to heal and not to divide? On today's episode of The Physicians, we'll be discussing digital health and how technology is transforming healthcare delivery in Nigeria with our experts today on your favorite health TV talk show, The Physicians. Stay tuned. It's another day with The Physicians, where your health is our business and will always be our business. My name is Dr. Martina Agberie, your regular anchor on this program. And today we'll be discussing digital health, the pros and the cons. With me as my guest today, not as a co-anchor, is our own very Dr. Maymunah Yusuf Kadiri. He is a consultant, psychiatrist, and a psychotherapist. And something you don't know about Dr. Maymunah is that she's an all-rounder. She's also very vast when it has to do with digital media. Dr. Maymunah, you're welcome.
Thank you. It's good to be here again.
Thank you. So now I'm just going to go straight to digital health, the pros and the cons. I know you are always on, we call you the celebrity shrink, right? And you are always very visible on social media. Very, very active, talking about mental health, promoting mental health, making it very relatable with people, and they're pushing, using different devices. People hardly know that you are that, especially when you are very deliberate in things you're doing. So using the social media as a platform, you've reached a lot of people.
Yeah.
And yes, and now talking about, that person that would, well, of course, you are the one that we have to speak with. Do you want to tell us your experiences about using this? Why, apart from using the regular medium of the television, going online, why do you think it's important for health people to use such a medium?
This is why we are physicians.
Exactly.
It's part of the digital media, reach more people, it's scalable, it's technology driven. Most importantly, health issues are very delicate, but highly trivialized, often glamorized online. And so when we have platforms like the Physicians, it helps to reduce misinformation, disinformation, and make people know the facts versus the myths.
Yeah.
We have a lot of Google doctors.
A lot of, you can say that again.
People go online and search. A case in point, the days of Ebola.
Yeah.
People woke up and said we should bathe with salt.
Yeah, and a lot of people did that.
People did that,
Yeah.
including so-called educated people. People died. So if you are an expert in a particular area, your niche, is good for you to be on social media.
So you can debunk a lot of things.
You can debunk a lot of, myths and let people know the truth. Let people know how to access care. And it's not only information you are giving now. With digital health, it's not easy to access health from the comfort of your home, from the tip of a finger, from, on the go, on anywhere you are, irrespective. It has broken the barrier. We still have one doctor in Nigeria to 10,000 Nigerians.
As against what the WHO recommends.
1 to 600. The only way we can help to bridge that gap is technology.
Technology, absolutely.
The Japa syndrome is also a major menace in the society. So while they are over there, they can still consult for people.
Absolutely, absolutely. So it's for people to be able to embrace it. You know what? Social media is good. It has its pros and its cons, right? But it's for people to be able to know how to get the real information, how to be able to separate. You can read a lot of things. You can see a lot of things on social media, especially when it comes to health. But how will people know the genuine
from the
fake ones?
So let me take you on that aspect of social media. Aside from digital health in general, social media, which is just part of it, is, of course, it will create digital footprint for you as a person, for your business, create awareness, make it easily accessible to get information, but it's now how to differentiate between the good or the bad. We have a lot of health enthusiasts, a lot of, 1 day, 2 days, 2 weeks training people that have come out to come and be calling themselves all manner of names, and they are dishing out. And if they have large followership, and they built a huge community, then people tend to listen to them and believe them and say, yes, this person said this. When you wake up in the morning, your first urine, drink it, and all that. And
I think we had a doctor, right, who came here once and said people were using battery water.
Yes, battery water for eyes, urine for eyes, all manner of things. So social media has its good, like you said, the good, the bad, and the ugly. But the truth is that it is here to stay. We cannot say we don't want social media. It is no longer within our control. It's now how do we harness the benefits of social media versus the harm.
Okay, so now coming back to health, right? We have a lot, like you say, we have a lot of Google doctors, and we have people patronize them, even when they are not trained. How have you been able to manage that aspect in your practice? Because I know very well that you have this app that is on.
So
the How Body app or something that you're using.
2020, COVID happened. We're not prepared.
The world was not prepared.
The world shut down. And there was a big vacuum. As it is, when it comes to my sector in mental health, we still have one psychiatrist to 1 million Nigerians. Like, it's still...
We're talking about a doctor to 10,000, and now you're talking about 1 to 10 a million.
We have less than 250 psychiatrists in Nigeria. We have 250 million Nigerians. So you see the proportion. And that goes for the psychology, psychiatric, there's still that huge gap. And as we're coming out of COVID, we saw the huge gap because isolation was minimum of 2 weeks. And then most establishments were shut down because once one person is ill, then everybody
they have to go
on lockdown. And we looked, okay, how do we scale? The Japa syndrome is there. A lot of countries were looking for mental health professionals. You cannot stop anybody in their pursuit for happiness. And so people were living. And, the mental health professionals, psychiatrists, psychologists, people were leaving the country in exodus. So, okay, what do we do? How do we help with the little resources we have here? And how do we harness this, build mental health equity so that people can have mental health at their fingertip, access, availability, affordability. And then that's how we came about how body, which is how are you in the English term. Underrated, undervalued, overlooked statement. Because when people say how are you, most times they don't check to know how really are you. So that is why we built How Body. Not only for Nigerians, for Africans, for people all over the world of color. Why? It helps to deliver culturally appropriate therapy wherever you go. So it's like therapy on the go. So on that platform, there are different aspects. There are free assessment. Everybody can access, go there and check if you are sleeping well. It's free. Finish the assessment, then put in your email. The result comes straight to your mail and tell you, you have insomnia, recommendation, do this, then the sleep hygiene is there. Sleep at this time, make sure your room is dark, make sure, and then if you need to talk to a therapist, it will tell you, recommended, seek therapy. Then you go to the session for the therapy. Click, talk to a therapist that is live on the platform, or you schedule to speak to a therapist. We will come on board and speak to you. And you see the therapist and you see the areas of expertise each one is, and then you click and see which one you want to speak to. Then there takes also the AI part of it. AI part of it talks about, resources for mental health. You want to check on that. Where we have ChatGPT, it has our AI buddies here, Zainab, who will chat with you on different things regarding your mental health. And then, of course, the AI paneled trackers to check your wellness. For women, their menstrual flow, your mood, your sleep. So you can actually schedule and say, in a month, I want to see how many hours I sleep and if I sleep well. So put it December 1st or January 1st to January 31st. And it will actually track and give you recommendation on whether you slept well, whether you are lacking, having poor quality sleep, whether you lack your sleep, and what you need to do.
Wow, that is the use of the How Body app. How do other people really, let's talk about the pros and the cons of using a digital app. How does it work? People that are in the rural communities,
Exactly.
How will they be able to access healthcare without leaving the comfort of their homes?
So those are some of the pros, because of, if you bring it down to our own community, where's the electricity, right? How many people have smartphones that they can use to go online? Exactly. So those are some of the downtimes. And if you are building a tech platform now, especially when it comes to health, you must also think about the people that are in the rural communities, underserved communities, hard to reach communities. How would they be able to access this care, in the comfort of their own without, coming out, without living? For us in How Body, what have we been able to devise? Mobile counseling booths. So the How Body is already there. It's a telemedicine platform. It helps to deliver mental health and psychological services and all that. But these hard-to-reach communities, they are not there. So these mobile counseling booths are stationary in those communities, solar paneled, enabled, so that you don't need electricity. Just 1 to 2, 3 panels, they can deliver the electricity. The tablet is there that you can be able to charge it and all that. So this is the way for us. We are saying we can also make them community-based in rural communities and speak to the gatekeepers. So if we are going to XYZ community, we have to get the community members involved, the gatekeepers, the religious leaders, the Bale, Oba, or whatever, the market leader, and let them know that this is what we are bringing to this community. It is our own. It is not my own. So that everybody can own it, it can be monitored, it can be taken care of. If anything, the control center is right in a domicile in our own center, where we can monitor if anything goes wrong. And this is more like a pilot thing now for us to see how it can work and what are the challenges it will bring. If it's going to be vandalized, what do we do about it? So some of the technology we are putting into it is that if the door is about to be broken up, it can, an alarm for us to know what is happening. If you go in there for therapy and you are there and you are quiet, you are not saying anything, no movement, it will ring an alarm for us, because we also don't want people to go in there and harm themselves. You know, another process is to also ensure that the door, before you enter, it kind of scans you to make sure you're not going with any weapon into it. Okay. So
these are just the things that are in the
yes, for the community. We've done a pilot with, you know, in the city, in one of the communities, not so rural, but satellite, but leaving it there for days is something the next phase we want to do. It was more like outreaches we did in those communities and moved it out. But now the next phase is dropping it in those communities for like a week or 2 weeks or even a month, and really understand how that works. And so people will use it and the issues.
I know you are very enthusiastic because it has to do with mental health. And so that is how the Our Body app works. So now talking about clinical medicine. For patients that have serious health challenges that can access the healthcare institution immediately, and then they need to use the digital media. How are they going to be able to do that? Because I know that we also have some apps that do that.
Yes.
That can attend to it. But when it comes to, for people that are listening, when it comes to getting a diagnosis, doing your investigations, submitting your report, getting your medication, so how does that process work?
No, technology has really gone far. I have gone, not just a digital expert, I have a master's in digital healthcare. So, and I kind of understand a lot that has gone into that place. So, for example, somebody that is very ill, that needs what you are trying to put in place, physical examination,
it's
you know,
yes,
and
definitely.
all that. Digital health has gone as far as doing remote surgery, robotic surgery from anywhere. We even have a Nigerian who has done that right now in Nigeria in recent times, right? So it can do, this a video call, they can do the assessment, somebody has to be there. So for example, the expert is there, here, and somebody is there, and then and then they are communicating if it has to like touch the body and all that. Digital healthcare has gone as far as you finish, you don't, even if nobody is with the person, the information goes to the lab affiliated to that organization. Yeah, like Our Body is linked to some pharmacy. So you don't even need to come. When you are done and you need medication, it will go program into the pharmacy that you are, and they will deliver to you. If it's laboratory, same thing, except you need to take blood. And some laboratory with the digital, they come to you, take your blood, take your urine, do all what they need to do.
Okay, so, fine. So that is where I'm actually going. So it is not just seeing, consulting online.
No, it goes beyond that.
It goes beyond that.
The
So
whole
it means
ecosystem.
at one point in time, when investigations need to be done, there must be physical contact.
Yeah, well, of course, if you have to take urine and blood and all that. And the beauty of this digital health is the fact that electronic medical record is also one of the, it's also part of it. We have gone as far as people now have been able to, break it that your record, when you are, for example, you're in Lagos, you see a doctor here, when you go to Port Harcourt and you're not feeling fine, they don't need to say, you are not our patient, we cannot access it. With your code, they will open up your folder there, and then they'll see what the people in Lagos have done for you. And they just continue. Unlike before, that's nothing, no history. So digital health is very impactful, scalable, and that is the only way we can really, meet people's needs because of the access.
Okay, so now talking about the consequences, rather, yes, I want to use the word the consequences. So why do you think people don't want to really buy into digital
It's something
health?
new. Everything that is new, people, it takes time.
It's resistant.
People will resist it, like they're skeptical. Are you sure? Is this you? And let's not forget, it's technology, it's online. People are also scared. Trust issues. What about my data? So that is one of the downside of digital health, of course, which is being worked on a day-to-day basis. Data privacy. Let's see, when COVID started, there was Skype. All of a sudden, Skype disappeared. Zoom took over.
Yes, true. Very true. Very true.
And then people were scared of using Zoom because, when you finish Zoom, everything will go in the cloud. If you saw the people are like, no, my information will be there. And there were doctors that were actually sued in some countries because they felt that their information data leaked. And this is where we have this authentication these days, end to end. There are some of those platforms that are way better than others, but when there's authentication, it seals or no information leakage is not out there. So the thing is that the digital health thing, yes, is new, is evolving, a lot is going on, AI is here to stay, and this is where the thing.
Now that you have just talked about AI, before I let you go, what do you actually think about it?
AI is good.
With diagnosis.
See, that is why it's called artificial intelligence. Why are you taking everything hook and sinker? It's artificial intelligence.
At what point do you need to draw the line? Because people, you and I will know exactly what
exactly.
you mean.
So the thing is,
at what point? Yeah. Because people trust AI, can trust
even
AI
more than the
yes.
right people.
And they will tell you this: is AI always
AI
right?
still hallucinates. So everybody listening and watching us now, that is why it's called artificial intelligence. We are the ones that feed it with all the things that it needs to do. As of now, we are having this discussion. ChatGPT is in court. Like 7 people have sued ChatGPT in the US.
Okay.
Because, especially in a particular case, this 23-year-old was with ChatGPT for 2-3 hours before he killed himself. And it was leading him on. Okay, you want to go, you want to die, or you are tired of this world. It's okay, you need peace, you can go, aided. So as far as the parents, as far as the parents are concerned, ChatGPT supported their child to kill himself. So they are suing ChatGPT. And what did they do? They are not quarreling or fighting over it. They went back and they are now looking more into safety measures. So as of the time we had this information, 65% safety. So there are some things you put on ChatGPT now, they will tell you it's not part of the community. They are not going to answer you. This is against their law, because people are now becoming more and more aware. This technology, I keep saying, is here to stay. Yeah. You can't fight it. You can only, be an ally, but make the good of it, the benefits, discard the things that will not be beneficial, and just ensure that, because it makes your work easier, faster, smarter.
Thank you very much. It makes the work easier, shorter, and smarter. Final word for your people.
Digital health is here to stay. Makes it your health, healthcare accessible, affordable. It may not necessarily be like you are breaking the bank, but affordable, available. For us in mental health, culturally appropriate therapy on the go is there. It builds equity and is scalable, and it makes it easier for you to access health anywhere you are. So make it your friend, not necessarily saying the bad about it, because there's always the bad side, but it's something that is for us to use and is here to stay.
Thank you very much, Dr. Maymunah. I trust that we are going to do this to this particular topic. I saw the smiles on your face. Thank you. And trust me, you'll be back again. And to our viewers out there, I just want to say thank you for being part of our program today, talking about digital health, the pros and the cons. Be open. Be open-minded. Don't close your mind to some things that come up. The technology is here to stay. Digital health is here to stay. You make very good use of it. The benefits are enormous. Yeah. Be kind to follow us on our social media platforms. Like Dr. Maymunah here as our guest, you can also be a guest here. Come and share your experiences. We're looking forward to hosting maybe an individual, you, someday, who is not a physician, who is not a doctor, who is not a nurse, not even a practitioner, but just a Nigerian, who want to tell us the experiences, what you have experienced in the past using digital health, or even using the normal hospitals as a source of healthcare. We'll expect you one day. Be kind to follow us on our social media platforms again, like I said. My name is Dr. Martina Agberie. Till next time, stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body,
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.